Aging is a journey that is unique to each individual, filled with wisdom, cherished memories, and the richness of life experiences. As we age, the body changes, and with it, so do our needs. While it's natural to focus on the joy of growing older, there are also important signs to be aware of, subtle indicators that may suggest someone is nearing the final chapter of their life. These signs aren't always easy to detect, but recognizing them can help ensure that our loved ones receive the care, comfort, and support they deserve. It's crucial to approach these signs not with fear, but with compassion and understanding. The final years of life can be beautiful, meaningful, and fulfilling, as long as we maintain an awareness of what our bodies and minds are telling us. Let's take a closer look at 5 signs that might indicate someone is entering their final year and how we can offer meaningful support. Welcome to our channel. If you love content that resonates with the heart, subscribing will allow us to keep creating stories that bring warmth and joy. We love to hear from you. Comment below and let us know where you're watching from, as well as your thoughts on this. Number 1. Unexplained weight loss or loss of appetite. Unexplained weight loss and a significant decrease in appetite are some of the most subtle yet telling signs that an elderly person may be entering their final year. While fluctuations in appetite and weight can happen naturally over time, a sudden and noticeable drop in either is often a signal that something more serious is at play. When these changes are not linked to an obvious cause, they may point to an underlying health issue or indicate that the body is beginning to wind down. As we age, a number of factors can contribute to weight loss and reduced appetite. Physical changes like a slowing metabolism, decreased muscle mass, and changes in taste and smell can make eating less enjoyable. Additionally, the digestive system can become less efficient, which may lead to discomfort or a sense of fullness after consuming even small amounts of food. In some cases, medications that seniors take for chronic conditions, such as heart disease, diabetes, or arthritis, can alter their sense of taste or cause nausea, further diminishing the desire to eat. However, when unexplained weight loss occurs rapidly or significantly without any noticeable changes in lifestyle or diet, it is important to take it seriously. This type of weight loss could indicate a serious health condition, such as cancer, heart failure, or gastrointestinal issues. Diseases like these often lead to a loss of appetite as the body diverts energy to managing the illness. The immune system may also be weakened, making it harder to fight off infections, further compounding the situation. Mental health is another important consideration. Depression, which is unfortunately common among the elderly, often manifests as a loss of interest in everyday activities, including eating. Seniors experiencing depression may withdraw socially and no longer find enjoyment in activities that once brought them pleasure. Meals, once a time of connection, may become unimportant or feel like an overwhelming task, leading to a dramatic decrease in food intake. If an elderly person seems emotionally withdrawn, fatigued, or disinterested in engaging with others, this may indicate that their loss of appetite is tied to mental health concerns. The combination of weight loss and loss of appetite can lead to malnutrition, which has a cascading effect on the body. Malnutrition can further weaken the immune system, lower energy levels, and contribute to muscle weakness, increasing the risk of falls and other health complications. It can also lead to a slower recovery from illness, making even minor health issues more difficult to manage. Without proper nutrition, the body struggles to function optimally, and the effects of aging become more pronounced. If unexplained weight loss or loss of appetite becomes evident, it is critical to seek medical advice. A healthcare provider can assess whether the issue is linked to a chronic illness, medication side effects, or mental health concerns. Identifying the underlying cause of these symptoms can help guide treatment and care. In the meantime, focusing on improving the nutritional intake of the senior can be helpful. Encouraging small, frequent meals and offering nutrient-dense foods that are easy to prepare and consume, like smoothies, soups, or soft meals, can help provide essential nutrients. Additionally, providing emotional support and ensuring that mealtimes are a social activity can help encourage better eating habits and overall well-being. In many cases, early intervention and monitoring can make a significant difference. While weight loss and loss of appetite are common in the later years, A sudden or sharp decline should not be dismissed. Number 2, strange dreams and hallucinations. Strange dreams and hallucinations can be unsettling for both the elderly person experiencing them and their loved ones. While occasional vivid dreams are common, especially as people age, a noticeable increase in bizarre, confusing, or unsettling dreams, or even hallucinations, can be a subtle sign that someone may be nearing the final stages of life. These phenomena are not always immediately alarming, but they can indicate that the body and mind are going through significant changes. As we age, changes in sleep patterns and cognitive function are natural. The elderly often experience disruptions in their sleep cycle, including more frequent waking during the night and changes in the depth and quality of their rest. This can lead to vivid or confusing dreams. However, when the content of these dreams becomes increasingly strange or disturbing, or if the person is unable to distinguish between dreams and reality, it may be a warning sign of something deeper at play. Hallucinations, whether auditory or visual, can also become more frequent in elderly individuals as they approach their final years. These may appear in various forms, such as seeing or hearing things that aren't there or misinterpreting common objects as something threatening or unfamiliar. These experiences can be caused by several factors, including the natural decline of brain function, medication side effects, or the presence of a neurological disorder. In many cases, these hallucinations are a result of conditions like dementia or Alzheimer's disease, which affect memory, cognition, and perception. However, other health issues, such as infections, dehydration, or even sleep deprivation, can also lead to these episodes. It's important to remember that strange dreams and hallucinations are not always an immediate cause for panic. However, when they occur frequently or seem to escalate in severity, it's a sign that the individual's brain and body may be undergoing significant stress or decline. This could signal a shift in their overall health, marking a time when they may require more intensive medical care or support. If strange dreams or hallucinations become more frequent or begin to interfere with daily life, it's crucial to seek medical advice. A healthcare provider will want to assess the underlying cause of the issue. This could involve reviewing the person's medication regimen to determine if any drugs are contributing to these experiences. For example, certain medications prescribed for conditions like high blood pressure or pain management can cause vivid dreams or confusion. If this is the case, adjustments to the medication may be necessary. In cases where the hallucinations or dreams are a result of cognitive decline, such as in dementia or Alzheimer's disease, it's essential to approach the situation with empathy and patience. The elderly person may not be able to fully understand that what they are experiencing isn't real, and this can be distressing. Providing reassurance, offering comfort, and creating a calming environment can help manage these episodes. Additionally, keeping a sleep routine that promotes restful nights, such as minimizing noise, limiting screen time before bed, and offering relaxation techniques, can help reduce the occurrence of unsettling dreams. Maintaining open communication with healthcare providers is vital in understanding the root cause of these symptoms. If necessary, medical treatment for underlying cognitive or neurological conditions can be pursued, potentially alleviating or reducing the frequency of these troubling experiences. Number 3, increasing fatigue, loss of energy, and decreased mobility and balance. One of the more noticeable and concerning signs that an elderly person may be in their final year is a significant increase in fatigue and loss of energy, often accompanied by a decline in mobility and balance. As we age, it is natural for our energy levels to decrease gradually, and a certain level of fatigue can be expected. However, when fatigue becomes overwhelming and persistent, to the point where it significantly impacts daily functioning, it may signal that the body is nearing its limits. Fatigue is a complex symptom that can have many causes. For older adults, it is often linked to the body's declining ability to produce and use energy efficiently. Decreased circulation, muscle loss, and slower metabolism all contribute to lowered energy levels, and this can manifest as exhaustion, even after minimal exertion. But when this fatigue is coupled with a decline in mobility or balance, it suggests that the body's ability to function as it once did is beginning to deteriorate. Decreased mobility often goes hand in hand with fatigue. As the body's muscles weaken with age, movement becomes more difficult and taxing. An elderly person who was once able to walk freely may begin to require assistance or rest frequently. Reduced mobility can also make simple daily tasks, like getting dressed or preparing meals, feel like insurmountable challenges. This physical limitation is often exacerbated by a decrease in balance, which can lead to a higher risk of falls. A person who struggles to maintain their balance or feels unsteady on their feet is at an increased risk of injury, which can further complicate their overall health and well-being. These physical changes are often an indication that the body is slowing down in preparation for the end of life. As the systems that support basic functions, like circulation, digestion, and breathing, start to decline, the person's energy levels decrease, and their ability to move freely becomes compromised. This is particularly noticeable in cases of chronic illnesses like heart disease, diabetes, or COPD, which can make even the simplest tasks exhausting. A senior who experiences this profound fatigue and loss of mobility may be signaling that their body is no longer able to keep up with the demands of daily life. When these signs begin to appear, it is important to assess the person's overall health and consider whether medical intervention is necessary. A healthcare provider can help determine the root cause of the fatigue and provide guidance on managing the condition. For instance, physical therapy or occupational therapy may be recommended to improve mobility and balance, while adjustments to medication may be necessary if fatigue is a side effect of treatment. For families and caregivers, supporting the elderly person through these changes requires a mix of patience, understanding, and practical care. Encouraging gentle, low-impact exercise, such as walking or stretching, can help preserve muscle strength and improve circulation. Ensuring that the environment is safe and free from hazards, like loose rugs or cluttered spaces, can help prevent falls and injuries. Additionally, providing assistance with daily activities, whether through home care services or helping with mobility aids, can help improve quality of life and reduce stress for both the individual and their caregivers. On a more emotional level, it is essential to provide a supportive and comforting presence. Fatigue and physical limitations can lead to frustration, anxiety, and even depression. Being empathetic and understanding can go a long way in helping the individual maintain their sense of dignity and self-worth. Number 4. Cognitive decline, forgetfulness, and confusion. Cognitive decline, forgetfulness, and confusion are some of the most profound and often troubling signs that an elderly person may be nearing the final stages of life. While some memory lapses are a natural part of aging, significant and frequent cognitive changes should never be dismissed as simply a normal part of the aging process. When a person begins to experience an increasing level of forgetfulness, disorientation, or confusion about time, place, or people, it can be an indication that the body and mind are beginning to slow down in preparation for the end of life. As people age, it is common for certain cognitive abilities to diminish, such as the ability to remember names, dates, or recent events. However, these instances are typically minor and do not interfere significantly with daily life. In contrast, when an elderly person exhibits more serious cognitive issues, such as forgetting how to perform basic tasks, becoming disoriented in familiar environments, or struggling to recognize loved ones, it suggests a more serious underlying issue. These symptoms may be caused by dementia, Alzheimer's disease, or other neurological conditions that cause the brain to deteriorate. Cognitive decline is often linked to physical changes in the brain, including the shrinking of brain tissue and the loss of neurons that are responsible for memory and other essential functions. These changes are not always reversible, and as they progress, they can have a profound impact on a person's ability to function independently. Forgetfulness may start to interfere with daily activities, and confusion can make it difficult to manage personal hygiene, medication, or nutrition. For someone who has always been independent and sharp, the loss of these abilities can be both frustrating and alarming. In addition to the physical aspect of cognitive decline, confusion and forgetfulness can also be tied to emotional and psychological factors. The elderly may experience periods of depression or anxiety that exacerbate cognitive difficulties. For instance, a person may begin to withdraw from social activities or become paranoid about their condition, leading to further confusion or erratic behavior. Additionally, the fear of losing mental faculties can sometimes cause a person to hide or deny their symptoms, which may make it harder for family members to intervene. The presence of confusion and cognitive issues is especially significant if they occur suddenly or worsen over time. These signs may indicate that the body and mind are shutting down, signaling the approach of the final stage of life. This period of confusion or memory loss can be deeply unsettling for both the individual and their family, and it often requires careful management and support. If cognitive decline, forgetfulness, or confusion becomes more noticeable, it's essential to consult a healthcare provider as soon as possible. A doctor can perform assessments and tests to determine the cause of the cognitive changes. Conditions like dementia, Alzheimer's, or other neurological issues can be diagnosed through a variety of diagnostic tools, including memory tests, brain scans, and blood work. While some forms of cognitive decline are progressive and irreversible, there are ways to manage the symptoms and improve quality of life. Medication may be prescribed to help slow the progression of cognitive conditions, and therapy may be recommended to assist with memory strategies and coping techniques. Providing a structured environment, creating routines, and using reminders for daily activities can help improve independence and reduce confusion. For caregivers and family members, it's important to approach the situation with empathy and patience. Cognitive decline can be frightening for the person experiencing it, and providing reassurance and stability can help alleviate some of the distress. Familiar objects, consistent routines, and positive reinforcement can provide comfort and help the person feel more secure. Number 5. Incontinence. Incontinence, or the inability to control bladder or bowel function, is a delicate and often distressing issue for elderly individuals, and it can be one of the subtle yet telling signs that a person may be nearing their final year. While incontinence can be a common problem for aging adults, especially those with specific health conditions, it can also signal a decline in overall physical health or an impending end of life. This is particularly true if the condition worsens suddenly or becomes chronic, and if it is accompanied by other signs of physical or cognitive decline. There are several reasons why incontinence may appear in elderly individuals. As people age, the muscles that control the bladder and bowel can weaken, making it more difficult to hold urine or stool. Additionally, the nervous system, which sends signals to the brain to alert the body when it is time to use the bathroom, may not function as efficiently. Health issues such as diabetes, heart disease, or neurological conditions like Parkinson's disease or stroke can also contribute to incontinence. For some, medication side effects may cause an increase in urgency or frequency, further complicating the situation. However, when incontinence appears as a sudden or significant change, particularly when other health issues are already present, it may suggest a more profound decline in physical health. In some cases, this symptom can be a signal that vital systems within the body, such as the kidneys, heart, or digestive system, are starting to fail. For instance, if incontinence is accompanied by a marked decrease in mobility, fatigue, or confusion, it may be a sign that the body's functions are becoming less efficient, and the person may be entering the final stages of life. Moreover, incontinence can be emotionally challenging for seniors, often leading to feelings of embarrassment, shame, or frustration. Many elderly people find it difficult to talk about incontinence due to the stigma attached to the issue. This can result in them withdrawing socially or becoming increasingly isolated. This emotional impact should not be overlooked, as it can exacerbate feelings of depression or anxiety, which in turn can affect overall well-being and hasten the physical decline. If incontinence becomes more frequent or problematic, it is crucial to seek medical advice. A healthcare provider can determine the underlying cause of the incontinence, whether it is related to a medical condition, medication side effects, or another issue. Depending on the cause, treatments or adjustments may include medications, physical therapy, or changes in diet. For example, pelvic floor exercises can help strengthen muscles that control the bladder, and dietary changes may alleviate some of the symptoms. Additionally, it is important to provide practical support for someone dealing with incontinence. Using absorbent pads, adult diapers, or other incontinence products can help manage the issue and reduce discomfort. Ensuring the person has easy access to the bathroom and maintaining a clean and safe environment is also essential. For caregivers, offering reassurance and maintaining dignity is vital. as the emotional toll of incontinence can be just as significant as the physical challenges it presents. Family members and caregivers should be proactive in addressing incontinence, both physically and emotionally. A person experiencing incontinence may be hesitant to discuss their struggles, so creating a safe and open environment for these conversations is crucial. Being patient and understanding can help reduce feelings of shame and frustration, ensuring that the individual continues to feel supported and respected. Thank you for watching. We hope you found this meaningful. Don't leave without subscribing. Your support allows us to create more heartwarming content. We'd love to hear from you. Let us know where you're watching from in the comments, and stay tuned for more that will inspire and connect us all. Remember, your subscription helps us bring more inspiration to life.